Welcome everyone. I'm honored to bring to you distinguished Dr. Oburu, a fully fledged orthopedic surgeon who also doubles as a lecturer in the University of Nairobi. He teaches both undergraduate and postgraduate students and also has impactful medical videos on social media platform. Doc, I'm happy to meet you.
Thank you. Thank you. Nice to meet you.
Kindly just introduce yourself shortly.
Well, my name is Dr. Ezekiel Oburu. I'm an orthopedic surgeon. I work here at Nairobi Spine and Orthopedic Center, but I also teach at the University of Nairobi.
Okay.
Yes.
What else do you do, Doc?
Wow. I don't know if I have much hobbies. Sometimes I go for walks.
Okay.
And things.
Yeah.
I spend time with my kids.
Okay.
Yeah, I live a pretty boring life.
I don't think so, Doc. So Doc, from experience as a lecturer, also as a medical student during your years, what do you think are the significant differences between medical school times in your years and the current regime?
I think that there is a world of difference.
Okay.
I could spend 20 minutes just talking about it, but to highlight but a few. Number one, in my time, there wasn't as much knowledge in my time as there is now.
Okay.
There was, the internet was just coming in the 90s. All right. I remember having a printout of how to manage sickle cell disease in my 5th year. That was around 1997 or 96, thereabouts. And that was a big deal. We were still referring to things as the internet.
Yeah.
I got it from the internet. So it wasn't this side or that side.
Okay.
So that was something, I was lucky though because my brother had an internet cafe, the second in the country at that time. Now, subsequently, now there's an explosion of knowledge. So everyone has access to the internet. YouTube, if you look at YouTube, YouTube is something that came in the mid-2000s.
Yeah.
But now YouTube is a major platform for education.
That is true.
Things like Instagram and Facebook and TikTok have become platforms that you can use to educate people. Podcasts were, I have a podcast called Orthotutorials, which I used to teach medical students. Podcasts, I say I listen to podcasts a bit early, maybe 2010.
Okay.
But podcasts have just become, there's an explosion of podcasts now. Almost anyone has a podcast.
That is true.
So I think the difference then is that there was paucity of knowledge, but now there's an explosion of knowledge. Now, the problem then was that you couldn't access the knowledge. The problem now is that you can access the knowledge, but sometimes as a medical student you need to know what to access and what not to access.
Yeah.
Yes, in terms of just knowing what to do and what, yes. Because you can have so much knowledge, but it can be like the sands in the sea.
That is true.
What's useful and what's not useful.
Actually, it can distract someone from focusing on the main thing.
It can. And I think that is quite, I was listening to an interesting podcast the other day called Hidden Brain. And what they were talking about is focus. Things like we now study with our phones. In my time, it was you and your textbook. But now, because our phones is what as a textbook, iPad, so we keep on, there's the notifications, you have an email, you have this person has liked your post on Facebook or Instagram or Twitter. So there's a lot of distraction. And though we have more knowledge, sometimes we're not as productive. Yeah. Because the focus is not there.
It's not there. And that's a good point, Doc. Now, many people are curious, Doc, like myself. How has your journey been? How did you become an orthopedic surgeon?
Oh, wow. I wanted to become a physician.
Okay.
I wanted to become a renal physician because I never found surgery to be intellectually challenging. Obviously, I didn't know much about it, and I was very wrong. Okay. But one of my teachers, a professor, challenged me, because he was quite intellectual and he was an orthopedic surgeon, and so that is what inspired me to do orthopedics. And then I got into orthopedics. So I had to do general surgery first. Because in my time, we could not just get into orthopedics. I did general surgery for a period of 4 years, and then I did orthopedics after that. I went to the UK to study orthopedics. So I studied orthopedics for about 6 years. Then I went for a fellowship in Australia. I took about 8 months in Australia doing a fellowship. Okay. I came back to Kenya, worked a bit, went for fellowship in the States to do foot surgery for 6 months, and then shoulder surgery for 6 months in the UK.
Okay. And how about becoming a lecturer? How did you...
Well, that started when I was doing my postgraduate in general surgery.
Okay.
The university advertised for a post of a tutorial fellow. So I applied for that, and after tutorial fellow, when I finished my postgraduate, I became a lecturer.
So how do you juggle between the two? Is it
I
easy?
think it's one and the same thing.
Okay.
You understand what I'm saying? Because I teach, and when I teach, I'm treating patients.
Yeah.
So it's one and the same thing.
How is it so far? Is orthopedic rewarding, as people say?
I think so.
Yeah.
You know, it depends on what you mean by reward. I'm not quite sure what success means and everything. I think that when you do your purpose in this world, you have really succeeded in whatever you do. You may not necessarily be financially rewarded as much, but you've succeeded. You know, you can't say that only doctors have succeeded, or engineers, or accountants, or financial analysts. No, even everybody, the security guard, when he does his job well, the house help, when they do their job well, the messenger in the office has in a way succeeded. You know, I don't think that it's one you can actually define what success is.
Okay.
Yeah. Having said that, if you want to be good in something, you gotta put in the hours. Yeah.
But Doc, kuna pesa kwa orthopedics.
I think that I would say this, that, you know, yes, you get paid.
Yeah.
Some more than others. I think spine surgeons are paid quite handsomely.
Okay.
But I think the days of making a lot of money, those days are probably not there as much.
Okay.
Yeah. So, and we have to accept that.
Okay.
Yeah. That you may not make a lot of money in medicine, but hopefully you'll be comfortable.
You're comfortable.
Yes.
Okay. With the current situation right now, you know, even getting this specializing sports is a bit hard. Because now I'm told we have so many orthopedic surgeons, many obstetricians. Do you think it's safe right now for me and the other young generation of doctors to also pursue orthopedics?
Yes, because orthopedic surgeons will be replaced.
Okay.
You know, I have my teachers now, the people who taught me orthopedics, are in their 70s. You know, and they're not as agile as they were. I mean, they're still knowledgeable and everything.
Okay.
But they tend to refer patients more. You know, they tend to discuss cases. It's not that they're bad orthopedic surgeons, no. They're quite good, and they really help by introducing orthopedics and making it possible that Africans could do orthopedics in this country. However, you can't do this job forever. It doesn't matter how good you are.
Okay. So most of us know you through the social media space, including myself. I knew you through Instagram. Why did you choose that direction of social media? Because right now, so many doctors, most actually shy away from the social media space. But I've just realized it can be very impactful to everyone out there in terms of the way you're doing. Why did you choose that direction, and why do you think it is important?
I think for me, what motivated me was, you know, we are a country of, I don't know what our population is now. I estimate 53 to 55 million people. Now, what motivated me was the fact that the lack of awareness of orthopedic conditions.
It is true.
So I'll give you, you know very well that in this country, many times you can purchase things just directly from the chemist. And patients go and they tell the chemist or tell somebody that, oh, you know, I have blah, 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 blah. And that's labeled as arthritis. Now, having trained in orthopedics, I know so many problems of the shoulder, you know, that are different, independent. So when somebody was saying that it's arthritis, I said, no, it's not arthritis. And that is why I decided that, no, let me have something that can educate people, so that people know that, wow, if you have this problem, it can be this, it can be that, it can be that. I always give this example that, you know, sometimes people, relatives, they tell you, look, I've got typhoid, I've got malaria, and there's very little typhoid and malaria in those places. It is because that's all that a clinician may tell them. Okay,
so how is it going so far for you? Because clearly
so far
we have...
not bad.
Okay.
No, of course, there's an uncertainty of work, about how you get work and everything.
Okay.
But so far not bad.
Okay. Most of us, like myself, we just finished internship. Some are young doctors out there unemployed. What is the one advice you can give to us? Because right now we are facing a challenge of unemployment.
Yeah, I think the challenge of unemployment is quite sad. You know, looking at it at the moment. But first, I don't think it's a problem unique to Kenya.
Okay.
You may think that our politicians have mismanaged the economy, and that may be partly true, but I don't think it's a problem to Kenya. I think it's a problem all over the world. You know, I remember when I was training as an orthopedic surgeon in the UK, I had many people from India coming there. Yeah. Some of them qualified general surgeons, qualified orthopedic surgeons, and they came and they became GPs. Yeah. So I think that we have to recognize that. And number two, you have to work doubly as hard. Okay. You know, you have to work twice as hard as a doctor. You don't want to slacken.
Okay.
And then the other thing is to look for opportunities outside the country. Okay. Sometimes we look for the UK, Australia, Canada, and the US because those are English speaking. But you never know, there could be opportunities in other countries that are not necessarily English speaking. Yeah. So that is what I would say. Okay. You know, that just keep at it. And sometimes also it's good to look outside. Yeah. Yeah.
Okay. Okay. Now for your people in the social media, for your following and other people, how can they reach you? Because I know they can text you, but how can they reach you?
Well, there is a phone number for Nairobi Spine and Orthopedic Center that we will give, and they can reach me through that.
Through that, okay. Do you take insurances?
Yes.
Okay.
Yeah, various insurance, APA, UAP, Liaison, quite a number of insurance.
That's okay. That's okay. Doc, what's the major case you get that you feel people can avoid out there?
It really depends. I think one way of solving a lot of orthopedic problems in this country, specifically trauma, is solving the border problem. Okay. If we solve the border problem, we will solve quite a significant amount of trauma. Okay. Yes.
Okay, so that's mostly the fractures from the accidents. Thank you, Doc.
Thank you so much.
Yeah, thank you so much.